So today in this video we are going to talk about two important bacteria. One is Corynebacterium diphtheriae and another is Listeria monocytogenes. First of all, let us talk about Corynebacterium diphtheriae. The Corynebacterium diphtheriae is the gram-positive rods that occurs in the angular arrangements. So if you see any gram-positive rods after the gram stain that happens to occur in the angular arrangement, then that is the Corynebacterium diphtheriae. Now, the Corynebacterium diphtheriae transmits by the respiratory droplets and it causes the diphtheria. The type of toxin that is produced by the Corynebacterium diphtheriae is exotoxin, and the exotoxin is encoded by the beta prophase, which inhibits the protein synthesis by ADP ribosylation of the elongation factor 2. So this is how it acts, this is how it inhibits the protein synthesis, and it ultimately results in necrosis of the pharynx, the heart muscles and the CNS tissues. The various symptoms of the exotoxins after its systemic circulation results in the pharyngitis. The pharyngitis we see in the Corynebacteria is pseudomembranous pharyngitis. You can also see in this picture the pseudomembranous pharyngitis. It is the grayish white membrane that occurs in the throat. You can see the grayish white membrane around the throat. That is the pseudomembranous pharyngitis. It is the pseudomembrane that is present in the person that is infected with the Corynebacterium diphtheriae, and it occurs with the lymphadenopathy. Lymphadenopathy also occurs with the person with Corynebacterium diphtheriae infection. So what are the various symptoms of the toxin dissemination? The various symptoms of the toxin dissemination are myocarditis, arrhythmias and neuropathies. The live diagnosis we can do is that we can do the Albert stain or gram stain. In those stain we can see the gram positive rods with metachromatic granules. You can also see in this picture, you can see the gram positive rods and you can see the granules at their ends. We also call these as metachromatic granules. Also there is positive ELK test for the toxin. We give the toxoid vaccine for its prevention. In the extended program of immunization of Nepal, the diphtheria vaccine is given early in the childhood, and for the treatment of the diphtheria we give antibiotic and diphtheria antitoxin. Now let us move towards the Listeria monocytogenes. The Listeria monocytogenes is the gram-positive facultative intracellular rod, and the transmission, how the transmission occurs is that when we intake the unpasteurized dairy products, there is the infection with the Listeria monocytogenes. Also, if we eat the cold meats, because the Listeria monocytogenes survive on the cold environment, and if we eat the cold meat, then we can also ingest the Listeria monocytogenes. Also, there is the transplantation transmission in the newly born child. The transplantation transmission occurs by the vaginal transmission during the normal delivery or vaginal delivery, and as I have already said, it grows well on the cold environment. So after it enters our body, it avoids the antibody of our body via the actin polymerization. There is the formation of the rocket tail in the Listeria monocytogenes. There is the formation of the rocket tail via the actin polymerization that allows the intracellular movement and cell to cell is spread across the cell membrane, thereby avoiding the antibody. And the characteristic tumbling mobility is seen in the growth. The various diseases that are caused by the Listeria monocytogenes are amnionitis, septicemia, spontaneous abortion can occur in the pregnant woman, the granulomatosis, infantisepticemia, meningitis in the immunocompromised patient, in the neonates and in the older adults. But if we look at the healthy adults, it is the self-limited gastroenteritis can occur. Self-limiting gastroenteritis occur in the person with the Listeria monocytogenes who have healthy immune system. The Listeria monocytogenes can be treated with the antibiotic, ampicillin. So these are the very important topics that we see, that we need to learn in the Corynebacterium diphtheria and Listeria monocytogenes. Again, I am going to tell you the Corynebacterium diphtheria causes the diphtheria, and which ultimately causes the pseudomembranous pharyngitis. There is a formation of the pseudomembrane, grayish white membrane in the throat. And the Listeria monocytogenes, causes the various diseases like amniotitis, septicemia, and it is one of the important causes of the spontaneous abortion, the granulomatosis, infantisepticemia, and meningitis in the immunocompromised patient, neonates, and older adults. So these are the very important note that you should know in the Corynebacterium diphtheria and Listeria monocytogenes. I hope you understood the topic. Thank you.